Hello everyone, my name is Janki Bohra and today's topic of discussion is to demonstrate an understanding of the caution in prescribing drugs likely to produce dependence and recommend the line of management. The subtopics that are covered under this topic are: first, drug dependence and management; second, general principles of drug treatment of dependence. Let us begin with drug dependence and management. The various terms used related with illegal use of drugs are drug abuse, drug misuse, and drug dependence. These are not clearly defined. However, an attempt has been made to define the commonly used terms to avoid the confusion. Some of the terms may be used interchangeably. Second, drug misuse. Inappropriate use of medicine that may lead to toxicity. It can be either acute or chronic. This is often due to ignorance. Many over the counter drugs, that is OTC or non prescription drugs, are misused as their use is unsupervised. However, patient does not consume such drugs to feel high as with drugs of addiction or abuse. Example: drugs for cough, multivitamin preparations, etc. In a broad sense, any drug that is used or prescribed without scientific justification, and even prolonged use of drug which is not actually required, can be considered as misuse of drugs. And drugs are also misused or wrongly prescribed by clinicians. Example: uses of antibiotics in case of viral fever. Use of corticosteroids as first-line agent in case of arthritis. Use of ceproheptadine as appetite stimulant are misuse of drugs. Next point is, certain drugs are misused as well as abused. These are prolonged use of laxatives and diuretics to reduce weight. Drug abuse. Use of illicit drugs. The persistent, excessive use of drugs inconsistent with or unrelated to medical or social practice is labeled as drug abuse. It mainly includes the use of illicit drugs such as LSD, cocaine, cannabis, volatile substance, or inhalant abuse. In this case, it is a more serious than use of drugs. Drug habituation. It is a pattern of repeated drug usage, though actual physical need is minimal. Therefore, there is no desire increase the dose of drug taken, and discontinuation of drug use is not associated with withdrawal syndrome or compulsion to procure the drug. Example: caffeine and nicotine. The term habituation can be used interchangeably with psychological or emotional dependence. The next point is drug addiction. It is compulsive drug usage and there is compulsion to obtain the drug at any cost, and discontinuation leads to withdrawal syndrome. However, addiction cannot be used interchangeably with physical dependence because there are examples where drugs cause addiction but no physical dependence. Example: LSD, cannabis, cocaine, and drug produce physical dependence but no addiction. The example is nalorphine. Next point: drug dependence. It is a psychic or physical state resulting from interaction between a living organism and a drug, characterized by behavioral and other effects that always include a compulsion to take the drug on a continuous or periodic basis in order to explore the psychic effect. Absence of drugs impair the ability of a person to function in a socially acceptable manner. Basically, drug dependence may be either psychological or physical. Further, we'll discuss on psychological or psychic or emotional dependence of the drugs. It is less serious and abrupt discontinuation of drug does not produce withdrawal syndrome, though emotional discomfort may occur. Example amphetamine, cocaine, cannabis, etc. Next point, physical or physiological dependence. It is a state that develops due to adaptation or tolerance produced by resulting of homeostasis mechanism as a result of repeated use of continuous presence of drugs. It is a severe type and severe dependence that produces withdrawal syndrome, that is physical illness, or abrupt discontinuation of drugs. Example morphine, alcohol, phenobarbital. Various systems are in equilibrium, that is, there is homeostasis. When a drug is used chronically, it disturbs the balance and creates a new balance due to continuous presence of the drug. It can be inhibition or stimulation. Withdrawal syndrome. Appearance of withdrawal syndrome is a diagnostic of drug dependence. It results due to CNS hyperarousal, due to abrupt discontinuation of drugs, and the symptoms are opposite to that of the drug causing dependence. Example opioids cause constriction of pupil, meiosis, and bradycardia. And during the withdrawal syndrome, there is dilation of pupil, myidrasis, and tachycardia. Second point of discussion, that is subpoint, is general principle of drug treatment of dependence. Treatment of dependence is still a challenge in spite of so many advancements in therapeutics. Drug therapy is used together with psychotherapy and psychosocial intervention. In chronic addicts, if overdose of drugs is consumed, at that time life saving is the primary aim. This is possible for agents where specific antidote is available such as opioids and benzodiazepine. The treatment outline is as follows. First, psychotherapy, rehabilitation, and occupational therapy. Second, psychosocial intervention. Third, substitution of less addicting drugs. Fourth, withdrawal of substituted drugs by gradually tapering the dose. Fifth, aversion therapy, example, disulfiram for alcohol dependence. Sixth, prevention of further dependence after complete de-addiction, example, by using naltrexone in cases of opioid dependence. Seventh, education of patient about harmful or deleterious effect on person as well as family. Eighth, specific treatment depends on drug on which patient is dependent. Now here are some MCQs. First, what is drug dependence? Option A psychological reliance on a substance. Option B, a physical need for a substance to function normally. Option C, both A and B. Option D, neither A nor B. The answer is C, that is both A and B. Second, which of the following is a common symptom of drug withdrawal? Option A, increased tolerance. Option B, euphoria. Option C, cravings. Option D, reduced heart rate. The answer is C, cravings. Third, what is the primary goal of drug treatment for dependence? Option A, to maintain the addiction. Option B, to eliminate all cravings. Option C, to reduce drug use and associated harms. Option D, to promote recreational drug use. Answer is C, to reduce drug use and associated harms. Fourth, which medication is often used to treat alcohol dependence by causing adverse effects when alcohol is consumed? Option A, naltrexone. Option B, methadone. Option C, clonidine. Option D, bupropion. Answer is option A, naltrexone. Fifth, which of the following approaches is commonly used to treat cocaine dependence? Option A, replacement therapy. Option B, detoxification. Option C, counseling and behavioral therapies. Option D, antipsychotic medications. Answer is option C, counseling and behavioral therapies. Thank you.